Hello beautiful people, welcome back to my YouTube channel. In case you are watching this video for the first time, please consider clicking that subscription button. And if you are a returning subscriber, thank you very much for your support and thank you very much for always clicking in. So today I want to talk about twins because some of you have been asking me to talk about twins and some of the what can they do to get twins. Of course, guys, to be sincere with you, there are nothing much, or there is nothing much you can do to get twins, but there are some factors that can be considered for you to get twins. And before that, we have different types of twins. We have the monozygote and the dizygote. Mono means one, di means two. Yeah, so mono means one, di means two, and the zygote just means the fetus, the baby, the fetus itself. So the monozygotic twins means that one ovum is fertilized with one sperms and then it gets split. And the dizygotic twins means that two sperms fertilize two different ovum and then they get split. The same way, after fertilization, they can get split into 3, 4, 5, and then we will call those ones the triplets, the quadruplets, and so on. And also, when you have monozygotic twins, the sex are always the same, and they usually share the amniotic sac, and they have one placenta, so they are one. And when you have the dizygotic twins is when you mostly the gender is always different, can be a girl and a boy, and the placenta is always different, and they grow in different amniotic sac. So what are some of the factors that can be considered for you to get twins, or some factors that can help one to get twins? Because I've said nothing much can be done for you to get twins. It is only God who can help you get twins. But we have some factors that can be considered for you to get twins. Yes. So number one, we have family history, especially on the side of the mother. If your mother had or their family has twins, you are likely to get twins. So that one is one factor that can help you to get twins. Number two, we have height. The research has said that those who are taller usually get twins compared to those who are shorter like me. Those who are taller usually get twins compared to those who are shorter than me. And another one is breastfeeding. When you are breastfeeding, all the research say that those mothers who got pregnant when they are breastfeeding, they are likely to conceive with twins. This is because when we are breastfeeding, there are hyperstimulation of the ovaries. So this one can help you to get twins. Another thing is that those who conceive when they are above 35 years, they usually conceive with twins. Mostly, this is because they are approaching their pre-menopause stage, and this time you get that there are hyperstimulation of the ovaries, and this will help you when you conceive past 40 past 35 years. You are likely to conceive with twins. Another one is in vitro fertilization. In vitro fertilization is whereby a woman cannot produce an egg which can be fertilized, and a man also cannot produce a sperm that can fertilize an ovum. So in this case, we always take a sperm and an ovum, and then they get fertilized in test tube, then they will be transferred to the uterus, and in this case the woman or the family or the couple can decide, so that they can decide that they need to be to get twins, and they and then the doctor can decide to implant two, three, or more twins. Another one is taking fertility drug like comifran. Comi? Like comifran. So comifran is a fertility drug. If you take this drug, or if your doctor recommended for you this drug, especially those who have they have the infertility cases, sometimes if the doctor recommends this drug, you can conceive twins, because this drug help your ovary to be hyperstimulated, so that when you get that, when the time you are ovulating, you can both both sides of the ovaries can ovulate, and you are likely to conceive twins. So those are some of the factors that can help you, or can be considered for you to get twins. The next thing that I'm going to talk about is some of the myths and misconceptions about twins. So some communities, they usually discourage twins, or if you give birth to twins, they will kill them, or they will do some funny things to you or to those kids. But those are wrong. Those are just myth and misconception. And also, some community usually believe that when you take a lot of folic acid, you can conceive twins. No. Some community also believe that when you take certain foods, you can conceive twins. And another community, or some community also believe that some position or sex position can help you conceive twins. Those are just myths and misconceptions about twins. So, how can you know that you are carrying twins? How can you know that you are carrying twins? Usually, when you miss your period, you at the back of your mind, you usually know that you are pregnant. So the next thing you will do is go to the hospital to check if you are pregnant. And if you get that you are pregnant, that result cannot tell you the exact number of baby that you are carrying. So the next thing you are supposed to do is just to carry the pregnancy until such a time that the pregnancy is big enough. Is when you go to the hospital, the midwives can palpate or can check you, and they can realize that you are having twins. And the exact the exact thing that will help you to know that you are carrying twins is when you go for an ultrasound. But there are some of the signs and symptoms that can help you, so that you can insinuate that you are having twins. Number one, the abdomen will look bigger than normal. Usually, when you are maybe at 6 weeks, I mean even 4 months, your belly can look like that you are 7 months. And another thing that will also help you to see, you will have a lot of hyperemesis gravidarum. This is vomiting a lot. Usually vomiting during the first trimester is always normal. But when you have a lot of vomiting, you can you can what? You can what am I saying? You can always have some insinuation that you are having twins. And another thing that will also help you to know when you are having twins is when the baby starts kicking, that is from 16 weeks to 20 weeks, you will have a lot of kicks, not just the normal kicks. You will always have a lot of kicks. So, what are some of the disadvantages of having twins or multiple pregnancy? Because you can carry twins, you can carry triplets, you can carry triplets, those ones. So, what are some of the disadvantages that will take place when you are carrying multiple pregnancy? Number one, stillbirth. Stillbirth is whereby you give birth to a dead child or dead babies. When you are carrying twins, you are likely to have a premature labor or premature delivery. And when this happens, sometimes you can have stillbirth. Number two is locked twins or conjoined. So when you are having so many babies in your stomach, or having multiple babies in your stomach or in the abdomen, why I'm saying the stomach, in the abdomen or in the uterus, you are likely to have conjoined twins. Conjoined twins is whereby you get that when the time you are going to deliver, you will deliver a baby where their heads are conjoined. Their heads are conjoined, their chests are conjoined, their stomach are conjoined. They are together. Their hands are conjoined, and sometimes sometimes they can share one brain, and you get that separating these twins can be very difficult. You might get that somebody has given to twins where they are sharing one stomach, and this one separating them can be very difficult, and they will have to live like that, or they get separated at a risk of getting at a risk of dying. So another disadvantage that will happen when you are carrying twins is having preeclampsia. Preeclampsia is whereby you are having high blood pressure in pregnancy or hypertension in pregnancy. So when you are carrying twins, you are likely to suffer from hypertension in pregnancy, or preeclampsia, or even eclampsia. And these eclampsia are usually sometimes they cause premature delivery. Another thing, you can have obstructed labor, because when you are having twins and the time you are going to deliver, you can get that another one is facing up, and another baby is facing down, and they want to get out at the same times. So you get that you will have a prolonged labor or obstructed labor, and also this one can predispose you to CS or cesarean section. And cesarean section, it is not always good, or it is not always advisable, because it is a major surgery and it has its own complications. So it can predispose you to CS, and also another disadvantage is you can also bleed when you are giving birth. You can always have placenta problem, because when they are monozygotic, you will always get that the placenta will always be big for them to share, so that they can get the nutrients, the oxygen, and all those that they get from the placenta when you eat, all those the extent that they get from the placenta. So when you are having twins, you are likely to suffer from uh, placenta problems. Another thing that will happen also when you are having twins, you will get that low birth weight, because sometimes they are always likely to be delivered before term, and this one will you get that you will give birth to a low birth weight baby, and a low birth weight baby is always not good, because the baby has not fully developed, and a lot of problem can set in after delivery, and this one it's always not good. Another thing that will always also happen is what? Preterm. Yeah, preterm is likely to happen, and also bleeding when you are giving birth. It will also, you are likely to go to have postpartum hemorrhage, which can cause death or shock, or any other thing. Another thing is also abnormalities. You can give birth to a baby who are having a lot of abnormalities. Those abnormalities, and also abnormalities are not good. So even though twins are always very beautiful, even though twins are always attractive, and most ladies and almost couple usually prefer giving birth to twins, but it has those advantages that I have said. So what can you do when you realize that you are having twins, or what will you do when you realize you are having twins? The first thing that you are supposed to do when you realize that you are having twins, you are supposed to go to the hospital, or you are supposed to go to the hospitals to be checked for any other complication that might set in during your pregnancy, And you will get that when you are having twins, you might have many antenatal visits compared to someone who is carrying one baby. And another thing is that you're supposed to deliver in the hospital, because you have seen all those disadvantages that I've said. So you can suffer a lot of complication if you don't deliver in the hospital. So I'll advise you, when you realize that you are having twins, please don't deliver in health center where there is no theater or dispensary. Go to a hospital where it is well equipped. You will get help, because a lot of complication can set in when you are giving birth. As I have said, there is nothing much you can do to get twins except those factors that I've said. So guys, if this was your first time for watching this video, make sure you subscribe and talk to me in the comment section. Tell me what you want to know. I will always respond. Bye. Let's meet in my next video.